Hi, and welcome to the training session for the change of standards of measurements for venous thromboembolism prophylactic care. I am your host, Flora Jones. As you know, Intermountain Valley View Medical Center thrives on being a cutting-edge leader in patient quality of care. We all know the seriousness of deep vein thrombosis embolism, also known as VTEs. In the worst case scenario, the outcome results in death. This next slide is not a pretty one. Venous thromboembolism is one of the most underdiagnosed conditions there is. Across the world, there's over 248,000 cases per year that are diagnosed. So we don't know how many have gone underdiagnosed, but we're going to change all of that by starting with VTE prophylactic therapy. As you know, VTEs cause serious illness, translating into an extended stay in the hospital, decreased revenue if the VTEs are acquired while in the hospital. VTEs also cause full or partial disability prior to causing death. VTEs are a preventable medical condition, and with early discovery, such as in this next slide, it's treatable. VTE is a non-discriminatory formation of a blood clot deep in the vein and does its most damage when a part of it breaks off and flows through the bloodstream to the heart or the lungs. The normal areas of blood clots formation is in the distal portion of the legs, the thigh, or pelvis, and on occasion in the arm. Okay, that's about enough review we need. Let's get started with the changes. How can you assist in preventing VTEs? I'll give you a second or two to think about that. 1, 2. Okay, time's up. It's fast and easy. Awareness of the criteria for VTE clients and identifying who is likely to develop a VTE. So what I want you to do is step outside the box with me in identifying patients that may not be on our radar for consideration of a VTE. Let's look at an actor whom is well known for doing his own stunts. Mr. Chan allows us to see at the end of his movies video outtakes that were not published in this movie. Visualizing those, we can see where he might be a candidate for a VTE should he come to the hospital. He may come for just a fever of unknown etiology. If you're my patient, I'd start prophylactic VTE therapy. If only just compression stockings, because I know if he has a fever, he's not going to want to get up and ambulate. The compression stockings will help him to keep his circulation going. Next, I'm going to show you a slide of an accident where a person could suffer severe blunt force trauma to the extremities. Yes, it's a little bit over the top, but you'll get the picture of why this could cause systemic traumatization, and VTE does not care where the opportunity comes from. Is anybody out there in the audience up for active sports? Well, perhaps not, but surely you know somebody 18 years or older who participates in events like basketball, football, soccer, various contact sports. You may even know somebody that's standing on the corner minding their own business. Somebody ran into them, knocked them down. They were also a setup for VTEs. Now, just before we go back into the box, let's talk about the assault victims. They're battered, hit with a broom, kicked, beat with baseball bats. Do you want to think about VTEs for them too? I do. Not just the people that present with VTEs, but those that could possibly get VTEs are the one that we're looking forward to. Okay, now we're back inside the box. Okay, inside this box we have limb confinement, which would be a cast or traction. Bed confinement would definitely be traction. Somebody that just was elderly and couldn't get up, over 60 years old, have other things going on, but mobilization is hard. So the people that are immobilized was what we're after. Disaster victims. You know, we're having disasters left and right, but nobody had a larger disaster than the Wicked Witch of the East. Let's take a look. Now, had she survived the house landing on her, like many people survived parts of buildings falling on them, woods falling on them when they're building homes and stuff, these people are subject to VTEs due to the trauma. People who are paralyzed, they sit for hours. Isn't that one of the criteria for VTE setup? You're right, it sure is. Sitting for long periods of time, car rides, airplane rides, wheelchair victims, all setups for VTEs. Now, what are we going to look for when they come into, when they're hospitalized? We're going to look for leg pain, edema to extremities, extremities that are warm to touch, redness, anxiety, and hypotension. Now I need to talk to the doctors. Doctors, you play a major role in the implementation of this new program. We have a screening tool for prophylactic treatment of venous thromboembolism. You have check boxes in categories such as non-prophylactic treatment needed, high-risk patients, low-risk patients. We also tell you the contraindications, which I will show you a little bit later. The screening tool is to be done within the first 24 hours after the patient is admitted to the hospital. You can do it when you admit them, and therefore it would be done. We need consistency to get this done. After you're through with that and you've printed it out, signed it, and dated it, give it to the HUC. She'll put it in the file. From there on, the nurses will take over. The nurses will be looking for signs and symptoms of VTEs that may arise while still in the hospital. Any changes that are negative in that aspect, the nurses will notify you. Let me just go over the list of things that we use for prophylactic treatment. Compression stockings, TED hose, sitting exercises, not allowing crossing of the legs, anticoagulants such as warfarin, heparin, and Lovenox, venous foot pumps, and patient ambulation. There's a slide that I can put on for you next that will show you all of these things so you can always look back at it. Before we wrap this up, I'd like to go over the list of contraindications for the prophylactic treatment of venous thromboembolism. Severe peripheral arterial disease, severe peripheral neuropathy, severe lower limb edema, severe leg deformity. Do you have all those severes? It was 4 of them. Active bleeding, high risk of hemophilia, thrombocytopenia, history of GI bleeding, an adverse reaction to heparin, severe hepatic disease with INR greater than 1.3, and those patients that are already on therapeutic anticoagulants. Let me put the slide up for you so you can have this too. As always, all good things must come to an end, and so has this training lesson. I just want to end with this though. It is up to each and every one of us to pursue and implement evidence-based changes that provide quality, cost-efficient care to the community who put their trust in us. To relook at this video, which is a stepping stone in the direction that we're going for the cutting-edge quality care that we give, you can see it again on YouTube. Good luck, and everybody work hard. Bye.